Welcome to Chiropractical Solutions and Massage. If you have any questions for us at any time, you can always email us at drweiss at drweiss.com, as you can see right through here. Or for more information, go to our website at www.drweiss.com. Today we're going to talk about frequently asked questions. Okay, I'm Dr. Weiss, and we get a lot of questions in the office, and we figured we'd do a couple video series about different questions that are most commonly asked. Frequently asked question number 3, what are causes of joint and muscle pains in the body? A lot of people ask us this. Well, you can kind of see from the picture, everyday things that we do, we don't even realize the effects they're having on our body. You can see this guy here is just watching TV, lounging on the couch. You know, this person here is in front of the computer. How oftentimes do we not notice our posture throughout the day? We're kind of just slouched forward. The monitor is facing downward. And what occurs is a lot of pain, discomfort in the neck, mid-back, low back. So the causes of joint and muscle pains in the body, there's two main causes. Okay? Now, number one is major trauma. Major trauma, which we're going to go into in detail. You can see, obviously, this is a major trauma. And two is minor traumas. Minor traumas are repetitive injuries over time. You can see this person is at the computer, they're sitting at the desk, and they're holding on to their low back and their neck. So we're going to talk about these two main causes and how this affects joint and muscle pains in the body. Well, so basically, number one we're talking about is major traumas. Major traumas are things like slips, falls, car accidents, sports injuries. These are events that occur hard and fast. Okay, we've all had some of these throughout our lives where we've fallen, there was a car accident, we played sports and we got, there was impact there. So, there's a couple things to demonstrate. Obviously, you can see this person flips off a chair, they slip, they're falling off a ladder. We're on ladders a lot. And here you watch out for the banana peels that are on the sidewalks. We also have fender benders. So even if it's not a huge accident, it doesn't have to be a major accident for it to provide a huge impact on the spine and the body and cause damage. Just a fender bender from 10 miles an hour, which doesn't seem like anything, does produce an effect and is a problem for the spine and the body. Okay, you can see sports injuries. This little fella here was trying to rollerblade and he fell. And there's some statistic where by the time the child is age 7, they've fallen thousands of times. So those are all traumas. And then you can see here this athletic trauma. Obviously, be careful about that. So those are major traumas. The second thing that we're going to talk about that causes joint and muscle pains is minor traumas. Now, minor traumas are repetitive injuries over time. Okay, this is sitting with poor posture, sleeping with poor posture, standing with poor posture. Now, sitting, sleeping, and standing is 100% of our day. So if we're doing it in incorrect posture, we're just ruining our spine all day long, every day. Okay, these are repetitive incorrect postures that add up and cause undue stress on the spine and the muscles. You can see again, this person's sitting here, okay, they're just slouching forward. You can see the poor posture through here, their neck, their low back, and they're just kind of looking down at the computer. They're probably doing this for hours on end. And here's a demonstration of what the actual spine looks like when the person's doing it. You can see the head's all the way out here where it should be right on top that's supporting it. So it's a huge strain in the low back and the neck. Here's sleeping posture. Again, this person's sleeping on their stomach, their head and neck is kind of off to one side. That's not good. That's going to put a lot of strain up through this area. Okay, and you can see also the standing posture. This person, a person has a forward head, a flat back. This person has a forward head, rounded shoulders, weak abdominals, and a sway back. And then you can see compared to a balanced upright posture. So those are all minor traumas, okay? We can all relate to some of these types of effects on the body. All right? Now, what are causes? Now, these major and minor traumas, what is that doing? What is that actually doing when you get into a car accident, when you have a sports injury, when you're sitting slouched at your computer all day long? What is that doing to your body? Well, what it's doing is it causes spinal bones to get stuck or misaligned. You can see right through here, this area is stuck, it's not aligned, and you can see it's putting a lot of pressure through this nerve that comes out, and that's going to cause pain. Now, these misalignments can irritate delicate nerves because the joints in your spine are so close to your spinal cord and nerve roots, as you can see right here. Now, too little joint motion and misalignments can cause serious effects because it can press against adjacent nerve tissue. So you can see here, again, we're looking at someone from the side view. You can see the huge irritation. If these joints get out of alignment or they're not moving, it's going to irritate these nerves right through here and cause pain and problems. Okay, so when spinal joints do not function properly, the muscles also can tighten up, creating imbalances in the body. So the discs, the ligaments, other connective tissues, and the joints become inflamed. Later on down the line, people develop arthritic degeneration, arthritis, bone spurs, and that kind of thing can set in. You can see, again, this is just depiction of someone, this is occurring in their low back. They're experiencing a lot of low back pain, or it could be even occurring through the neck. So basically, the chiropractic physician, the chiropractic doctor, is a licensed healthcare professional dedicated to the detection, reduction, and prevention of spinal nerve irritation from these misaligned and fixated areas of the spine. Let me say that again. It's really important because there's no other professional that works with getting those joints moving better and better alignment that is as specialized as chiropractors. That's what their training is for. Okay? So it's for the detection, reduction, and prevention of the nerve irritation because the spine is misaligned and fixated. Okay? Massage also is one of the best modalities to help relax the tight muscles in the body, which are all connected to these areas. So the next thing, again, those are some of the causes and what we see in the body, the after effects of these major and minor traumas. Now, what are some of the solutions? Okay, obviously, the solutions we talked about is there's many solutions. Going to the chiropractor for one. Okay, we go to the dentist for our teeth because if you don't and you have cavities, they're just going to keep getting bigger and bigger. So the chiropractor is essentially helping the cavities, quote unquote, in the spine. So getting those joints moving better and better alignment, which takes pressure off of the nerves. That is what the adjustments are going to do. Okay. Number two, get a massage. Right? We all have tight buildup of muscles from stress, from work, from daily activities, from sports. Really need those worked out. So massage is one of the best things to help relax the tight muscles. 3, to help strengthen the core. Okay, core stabilization is going to stabilize the spine. So doing core exercise, the gym, Pilates, yoga. Again, just be careful because if you do have an injury, it's best to get it evaluated first. Even if you go into a chiropractic office, sometimes they'll give you core exercises to do at home and at work. And then, lastly, that kind of feeds into the last portion, which is, the healthcare professional, the chiropractor, is going to give you certain exercises, postural exercises to do at home and at work. Okay, so you want to practice those. Practice correct posture with sitting, standing, and sleeping. Okay, so to prevent it from progressing even more. You could see this person here. Their entire back should be supported, hips as far back as possible, working surface is at elbow height. You can see this person's looking straight ahead. Their neck is over their shoulders, not to put strain on the neck and the head. Knees are level to or slightly lower than the hips. Right? You can see this person here is sleeping comfortably on their back with a proper pillow. Their neck is supported, and the spine is in alignment in this position. So these are the causes of joint and muscle pains with the major and minor traumas, how it affects the body, and the solutions. Thank you, and have a wonderful day and a healthy day. Please forward this email to others. Our goal is to help spread the word of health, and send this to your family, friends, and tell them to go to drweiss.com and sign up for our free health newsletter so they can get some great health information as well. Thank you very much. We hope you have a happy and very healthy day.